Okay, so hello everybody. And I'm going to talk about the work that we are conducting in our team located at INRIA in Rennes, in the Brittany region. So it's the west part of France. Our team is called Seamless, and it's a team dedicated to virtual reality. So today I'm going to talk about the design of healthcare and medical systems based on virtual and augmented reality technologies. And so my name is Anatole. I'm a senior researcher at INRIA and member of the Seamless team from INRIA Rennes. So first of all, the Seamless team is composed of around 35 people. It's located, as I said, in Rennes, in the west part of France, 1 hour, 30 minutes, 2 hours from Paris by train, working on virtual reality technology, perception, and application. And the research project at Seamless is dealing with the design of 3D immersive and interactive technologies, also called XR for extended reality, encompassing virtual and augmented reality technologies, extended reality. There is a close link with perception, psychology, and neuroscience in our team, and we collaborate with researchers from those fields too, as our scientific topics are covering software models and engineering for virtual reality, augmented reality, extended reality, 3D user interfaces, haptics, force feedback or tactile technologies, brain-computer interfaces, BCI, avatars and virtual embodiment, etc. And applications are really wide in our team. We cover a very large spectrum of application fields and area, starting, of course, with medicine, but also cultural heritage, industry, multimedia, arts, construction, entertainment, etc. You see here a video of our Immersia virtual reality room located in Rennes here. Do you see the video? Just checking.
Yes.
Can you see them? Yeah? Audio feedback, please.
Yes, it works.
Okay, perfect. Thanks. So the topic of now of mixing XR technologies and health or medical applications is actually pretty ancient in the field of XR technologies or virtual reality. It's pretty old and historical applications for those technologies. Here you see some pictures from one of our first work on this topic dating from 2003, more than 22 years ago. It was a system dedicated to visually impaired people to explore virtual environments with a virtual blind cane here, mounted at the extremity of a haptic device, which was simulating the collisions and the shocks with the environment, following here blind people pass here in the Cité des Sciences and Industry in Paris, a famous science museum in Paris. And you see here the simulator, which was dating from 2002 here, for simulating those paths for blind or visually impaired people. So it's pretty old, very concrete field of research and application and transfer with several companies designing XR for health. It's already marketed and it's really rich and varied in terms of pathologies and economical models also. If you look at the different ways XR and health can be associated and how XR could be used for health applications, for instance, it can concern diagnosis or treatment, such as for diagnosing visual, motor, or cognitive problems, for the treatment of pain, stress, sleep problems, depression, etc. There are many virtual reality simulators for patients. Also for the simulation and visualization of data or virtual patients. There can be many occasions to use virtual reality simulators with various objectives, either for calculations, for pre-op or during operation visualization or simulations. And it concerns a large variety of data at the level of, at different scales, at the level of molecules, tumors, fluids, lesions, etc. A third category of application of XR for health is training and education, such as for surgeons, for nurses, to be trained in a very safe and well-controlled scenario and simulators, but also for patient or for family, in very different contexts, for triage simulation and so on. It can be also interesting to use VR as a nice environment to simulate and in a very realistic way some situations. A fourth category is rehabilitation, of course. Virtual reality is and has shown already to be extremely useful and very powerful for motor, cognitive behavioral therapy, and so on, for the rehabilitation, for instance, of after stroke, etc. And of course, for assistance or substitution for disabled people, there are many systems using VR and multisensory interfaces for disabled people, either for the training, for awareness raising, for assistance of disabled participants and people. So let me give you also some feedback about how we have conducted this partnership and potential transfer actions and collaborative research between our research activity on XR and hospitals and clinical partners. Let me focus on a successful partnership with the Rennes Hospital, CHU Rennes, the University Hospital of Rennes, our city in Brittany region. We have a long-term partnership with this hospital, more than 10 years. 4 years ago, we integrated a medical doctor in our team as a permanent staff member, Dr. Mélanie Cognier, both rehabilitation specialist and medical doctor, and a researcher in virtual reality. And together with Mélanie, we have set in place a very successful process for successful collaboration between a computer science lab and the clinical institute like the Rennes Hospital. So let me step by step explain the process. So we, together with Mélanie, we identify a clinical challenge and the need, for instance, for patients or for the medical staff. Starting from this need analysis, we formulate a scientific hypothesis or questions which are interesting for both clinical and computer science experts. Because from our experience, if it's just a clinical question, then it's not super interesting for the computer scientists that we are. And if we come with our engineering perspective, many times it's not meaningful for clinicians in the end. So we try to identify a common scientific question which is of common interest for both sides. Then we co-design innovative technical devices, including hardware or software designs. We test first with healthy participants, for instance, in our lab, but also outside the lab. And then we engage in clinical studies to measure the potential interest of our developments. We end up with publications at both computer science and clinical medical journals or conferences. And occasionally we consider transfer actions, such as with patents or startup companies. Let me show you now some examples of recent projects, which are all illustrating these successful collaborations with clinical partners in Rennes area. So let me show, for instance, this first project, ADAPT, which is mainly led by another team in our research institute called Rainbow, specialist of robotics. But here we use virtual reality to simulate and train wheelchair users, motor disabled patients, to get familiar with electric wheelchairs, which can be quite complex to control and to drive, and they can train here in virtual reality in a safe environment. Here is another example for disoriented patients, mainly for Alzheimer patients, people suffering from dementia. The idea is to use augmented reality glasses, like in the past the Microsoft HoloLens, to help disoriented patients during their navigation. And here you see a maze that we built in a gymnasium in Rennes with cardboards. And people have patients, Alzheimer patients were brought to this gymnasium. We had a clinical study with 20 Alzheimer patients coming, and they were to achieve a pass in this maze. And to do so, they were helped with several augmented reality guidance systems, like those little virtual cues here that you see, either this little puppet and this little companion, virtual companion here on the bottom left, or some virtual arrows appearing in the maze, or this trajectory here appearing in the maze too. So here the idea is to develop multi-sensory interfaces for Alzheimer and dementia people to navigate in a maze. Another example here with cancer specialists in the Caen region. The objective here is to propose a vocational reintegration and rehabilitation and cognitive rehabilitation after a breast cancer. So for women who have suffered from a breast cancer, and sometimes it's difficult to go back to work, especially due to some cognitive sequels after the cancer. And here we are training in a very safe and well-controlled environment those women to get more confident and more comfortable before going back to work in this vocational program for cognitive rehabilitation and facilitation of reintegration to a working environment. The project is called Victory. There is an ongoing clinical study in Caen at the moment. Here is another example in the field of motor rehabilitation after stroke. So here we use our expertise in BCI, brain-computer interface, and EEG real-time processing for proposing here a system for the re-education after stroke of the upper limb by watching a virtual reality feedback of a virtual hand and accessing the EEG from the patient. We can measure the brain activity in the motor region and get a reward either with visual feedback, but also with haptic feedback with vibration here. Special kind of vibration which are generating proprioceptive illusion. I can comment later if you're interested. But here we are proposing multisensory feedback for motor rehabilitation based on neurofeedback and EEG and brain-computer interface. There's an ongoing clinical study at the CHU Rennes with, I think, 40 patients at the moment. And then one last example is the Verare project. It's a very challenging project which was created after, during the COVID crisis in France, when the intensive care units were very loaded with patients, and we wanted to find new ways to propose motor rehabilitation for patients in intensive care units. So you see those patients here on the left are very fragile. They are just waking up from coma and they are extremely fatigued. They are usually suffering from a strong impact in their muscles, and they need to recover walking quite, it takes some time to recover the walk and the walking. So here the idea is to use virtual reality to embed an avatar which is walking, and with action observation inside this avatar, we hope that we are starting the training and the motor rehabilitation earlier in the bed of the patient using virtual reality to fasten and accelerate the recovery of the walking in intensive care units. The clinical study has just finished. We could embed 65 patients in intensive care units in Rennes Hospital, and we are looking forward to checking the results of this very challenging study. Okay, that's more or less it for my presentation about healthcare systems, combining virtual and augmented reality technologies with other multisensory interfaces for the benefits, we hope, of patients.